Do non-covered services count towards my out-of-pocket limit? Imagine planning a trip and knowing exactly how much money you need to cover your expenses. When it comes to healthcare, understanding what counts toward your out-of-pocket limit is just as important. Let's break it down so you can manage your costs confidently. Your out-of-pocket limit is the maximum amount you pay each year for covered medical services. This includes deductibles, co-payments, and co-insurance for services your Medicare plan covers. Once you hit this limit, your insurance pays 100% of covered services for the rest of the year. For Medicare Advantage Plans in 2025, the maximum out-of-pocket limit is $9,350 for in-network services and $14,000 for both in-network and out-of-network combined. Some plans may set lower limits, so it's good to check your specific plan details. If you have original Medicare, there is no out-of-pocket maximum, so your costs can keep adding up indefinitely. Now, what about services that Medicare does not cover? These are called non-covered services. They are your responsibility to pay for entirely. Examples include cosmetic surgery, long-term care, routine eye exams for glasses, hearing aids, most dental work, massage therapy, and routine physical exams. If you get these services, the costs do not count toward your out-of-pocket limit. That means if you pay for a hearing aid or a dental cleaning, those expenses won't help you reach your maximum out-of-pocket amount. It's also important to know that if you see providers who have chosen not to participate in Medicare or have opted out, the costs for those services don't count toward your limit either. This includes out-of-network providers when your plan doesn't cover out-of-network care. So, if you go outside your plan's network or provider list, the money you spend on those services won't reduce your out-of-pocket total. Prescription drug costs under Medicare Part D are a little different. They have their own separate out-of-pocket limit, which in 2025 is set at $2,000. Once you spend that amount on covered prescription drugs, your plan covers the rest for the year. This separate limit helps you understand your total costs better. Knowing these rules helps you plan your healthcare spending more wisely. When you budget, remember that only covered services count toward your out-of-pocket maximum. Non-covered services can add to your total expenses without helping you reach that limit. For seniors on fixed incomes, it's smart to ask your provider or plan whether a service is covered before you receive it. This way, you can avoid unexpected bills and stay in control of your healthcare costs.